Hi, my name is Nancy Cheeksamora, and I'm an associate professor at the University of Missouri. I'm excited to tell you about a new article of mine that's coming out in the Journal of Developmental and Behavioral Pediatrics. And the article is called Assessing and Promoting Independence for Young Adults with Autism Spectrum Disorder. And we know autistic young adults rate themselves as having low quality of life, and they often report lower levels of employment as well as independence. And I wanted to do this study to really understand better why that's happening and what their experience is as they transition into adulthood. So I asked them those questions in a qualitative interview. I asked 15 autistic young adults between the ages of 18 and 25, what their experiences were like as they moved into adulthood, what they wanted out of life, and what services or supports did they need. And I found four main themes. So the first theme was driving is really important. I had several participants in the study that were driving and really talked about this as a point of pride and how it helped build their confidence and independence in other ways. Other participants talked about how important driving was and how it was a goal of theirs, and they thought that they weren't going to be able to be independent until they started driving. The second theme was desire to live independently. And again, we had some participants that were living independently, and they were, again, really proud of this fact and that it was helping. They were learning step by step how to be independent. And then others really wanted to live alone or live with a roommate or just live away from their caregivers. And they were okay with it looking differently than maybe it looks like for typically developing young adults. But that was still something that they wanted to achieve regardless of sort of what mechanism it took. The third theme was decision making, and many of them talked about how they didn't feel like they were really able to make decisions that mattered in their life, and that how they really needed autonomy to be able to make decisions that were important for themselves and their futures, and how they needed caregivers and others to be able to allow them or help facilitate them to make those decisions. And our fourth theme was support services. So a lot of our young adults talked about the fact that they had mostly just employment support and some educational support, but very little other support. And that most of that support was facilitated by their caregivers going out and finding it for them. And so there were some gaps in social support services and other assistance that would have helped them become more independent and reach their goals. I'm really excited about this study because I think that it represents well what autistic young adults want in life, and it shows us that all young adults are very similar in their goals for independence, and that we need to provide the specific supports that will really help autistic young adults reach their goals. And so I think that it has some really important takeaways about what services we could be doing a better job providing, and how we also should listen to young adults and really get an understanding of what they want and help facilitate that. Thank you so much for your time, and I hope you enjoy the article.